Hello everyone, this is Dr. Akif Beg. I am a consultant cardiologist from Guntur. Today I am going to discuss about something which is very commonly asked by most of the patients, especially by heart patients. There is always a concern about their marital life or marital relationship, and they always ask this question that can they involve in sexual activities after having a heart disease. So this is a very common question, and for which I am going to answer that, whether they can involve in intimacy or physical relationships or in sexual activity or not. So any patient of heart disease can involve in sexual activity, but it depends upon conditions. There are three things which they have to see: that what is their physical caliber. Suppose a patient can climb 20 stairs without stopping. If a patient can climb 20 stairs without any chest pain or breathlessness, then a patient can indulge in any physical activity or sexual activity because it involves a similar amount of physical exertion. Second important thing, suppose what patient can do is they can try to walk for 5 minutes, and they should do a brisk walking. So 5 minutes of brisk walking, what does it mean? It means that if a patient can walk around 100 steps per minute, so if they have a watch and if they can check there that if they can walk 100 steps per minute without any chest pain or breathlessness, or they can walk at around 5 to 6 kilometers per hour speed, if they can walk in that without any chest pain and breathlessness, then they can indulge in any sexual activity. Other point to remember, that any heart patient, whether it may be a stent patient or any patient, after meals, suppose the patient has taken meals now, there should be a minimum gap of around 1 hour minimum should be there before indulging in any type of physical intimacy or sexual activity. So that is very important, because that can create extra load on the heart and can lead to sudden collapse of the patient. And also important thing to remember, that any heart patient should not use medicines like Viagra or sildenafil without the prescription of a doctor for the sexual pleasure or sexual erection and all. So this can actually cause a lot of damage, and patient can suddenly collapse during the sexual activity. So if the patient remember these three things, so they can then involve in any sexual activities or physical relationship. But always it's better that whether the patient can do a sexual activity or not, it all depends upon which type of heart disease he has. So it's always better to consult your doctor or consult your cardiologist before getting involved into physical activity. And also to remember that if a patient got heart attack and has a stent implanted, so minimum gap of 4 to 6 weeks is recommended. So they should keep a gap of around 4 to 6 weeks before indulging in any kind of sexual activity. Thank you.